Today, we're exploring a trend that's gone from playful to, quite frankly, problematic and may now require a legal response. Are beauty aisles and TikTok putting your child at risk? California lawmakers have introduced Assembly Bill 2491, widely known as the Sephora Kids bill. The bill proposes to restrict how active ingredient skincare is marketed to children under 13 years old. This comes in response to a surge in preteen skincare obsession. Well, to help us navigate this crucial moment, Dr. Masood Saman is a double board-certified facial plastic surgeon and the force behind at Saman Plastic Surgery. He trends extremely well on social media. He's also known as the rhinoplasty guy. Dr. Saman's practice is rooted in harmony, ethics, and surgical excellence. He's also a father of 3 daughters and a fierce advocate for protecting youth from aesthetic harm disguised as, yes, self-care. Seeing the long-term results in your practice, how has this early exposure to filtered aesthetics and skincare routines affected what young adults expect from their faces and from surgeons like yourself?
Well, we're now seeing more and more young adults, or even before that, tweens and teens that come in requesting to look like a particular filter or a particular celebrity, kind of signaling that they're no longer happy with how they look, with their self-image, which then explains why there's so much depression and anxiety in this age group. I see it every day, and we have to turn down more patients than we accept simply because the requests are unrealistic. They come from the wrong place. Look, what's happening is that patients are after these perfect symmetries that are not attainable. They want absolute glass skin. Nature disagrees. There's hormonal changes. There's changes that the skin is naturally supposed to go through. When the hormones hit, you're supposed to produce more sebum, which then protects your skin during that time. To for example, expose a child's skin, which has a very thin stratum corneum, the superficial layer of that skin, to glycolic acids, for example, would have an extremely drying effect because they don't produce as much sebum as a 20-year-old.
Right.
So there is a lot of nuances that we need to talk about. And I know these days we, as parents, really want to be best friends with our kids. And I get that. It's very difficult as a father too. But sometimes we just need to step it up and parent.
Yep.
Not talk about prevention so much because there's nothing happening there. Protection, just like it was mentioned earlier, we need to protect, and you need a moisturizer, a basic gentle moisturizer. You need sunscreen. You need hydrated skin. And then the rest of it comes down to go out and play, go meet people, go have fun, and let kids be kids.
Yep.
And beyond that, let's not introduce adult insecurities in children who don't need to be insecure about their skin.
Right.
I mean, we all want to look good. And we know this is thousands and thousands of years of humanity, whether it was piercings or tattoos or whatever it was, there was some effort we made always to look good.
Yep.
But to introduce that at such a young age, I think is just unethical.
I agree. Agreed. Now let's chat the medical view on the bill. So California's proposed bill is a major move, but it also has critics. So from your perspective, Dr. Saman, does restricting skincare marketing to kids make sense? And where should regulation begin and end?
Well, I think, yes, it's a nice starting point. But I think parenting matters more. Because who's to say that the mom's not going to give in to the pressure? And that pressure is real. Trust me. I have 3 daughters, and I deal with it every day. And I'm figuring it out all myself, and far from having figured it out. But the pressure is real, and they don't want to be isolated. And as kids, being banished, being isolated is social death. And so they want what their friend or their kid influencer said they should get. So if we introduce the law, it's a nice starting point, but what's to say that the parent won't buy it for them anyway? I think the most important thing is to empower parents to step up and parent and say
it's
no.
like the cell phone ban.
Yes.
Absolutely ridiculous. Or the social media ban. Like who's actually enforcing this stuff? Now, that's a grounded response. It's not about panic. It's about boundaries and protecting young minds before they become adult. Patience is extremely critical. Now, Dr. Saman, speaking to your daughters, you've said before that being a surgeon is only part of your job. Being a father is what keeps you centered. How do you talk to your daughters about beauty and confidence and the noise online?
It's hard. It's the hardest job I've ever had. It's much harder than any surgery I performed, that's for sure. I have 3 daughters, and they're all in different phases. One is 10, one is 8, The other's 5, but the 10-year-old and the 8-year-old for sure keep me on my toes. And we try to stay honest. We try to have conversations. I try to model the behavior that you are worthy and you are accepted regardless of how your skin shines today or what product you're using today. We try to keep them grounded and realize that self-worth comes from within and not just a reflection on this ever-scrolling window and mirror that will always tell you you're not pretty enough. But one thing is for sure, this anxiety that this generation is experiencing has to do with the fact that they're always being presented with something that they feel if they don't have it, they're left out, and they're left out of social circles. The ethics of this lies not only with the parents, with me, with other parents, with my wife and all fathers and mothers, but also with the CEOs, also with the society at large, with the government to some extent, with the stores that carry these products, with social media companies. All of us have lost our minds. We need to just come back to realize that children need to be on their bikes and go and have a smoothie.
If you could erase the top 3 myths younger patients believe about beauty, what would they be, and how can we help parents reframe those ideas at home?
Good questions, Anne. I think the number one myth that I see is that patients are in search of perfect symmetry. There is no such thing. There's no human, animal, leaf, mountain, or anything that is perfectly symmetric. And we have found this obsession with perfect symmetry. And a lot of it is because a lot of the assets online are digitally manipulated. They are made to represent that. In fact, just a few years ago, I started an social artistic project called Face by Face New York, where myself and my team would go to Central Park and we would photograph thousands of individuals. And they would tell us a little bit about their background. And we published this. And we look, and where are these tents? Where are these bombshells we see on social media? They do not exist.
Yeah.
And our children just think that, everybody's doing something. Maybe it's this product or this nose clip or this thing that pulls the hair or whatever. I assure you, most others are also, just like you, just scrolling along. Nobody's doing anything. Stop falling for these things. Live your life. Take it easy. Yeah, I don't know if it was 3, but I think that's plenty.
We need more surgeons who reshape minds as well as faces. So thank you. Surgery. What's advancing in facial surgery? So in your world, technology moves so fast. Are there any innovations in rhinoplasty or even facial surgery that are improving outcomes and really truly reshaping your field?
When I first started facial plastic surgery, I was doing it all. I was doing cancer surgery, reconstructive surgery, trauma surgery, and aesthetic surgery. Very quickly, I realized to be able to stay at the forefront of all of this, I had to bring it down to a few things that I was excellent at and just let go of the other ones. And that was rhinoplasty and facelift surgery, facial rejuvenation in general. In our world, now things are different. I have to tell you that most of our patients, despite this conversation, are completely grounded, normal individuals who are very happy with themselves, successful individuals who just have a little hump they want to remove, or they have a little bit of sign of jowling that they want to improve, and we do the surgery. Now, based on the advances in technology and advances in techniques and our own artistic understanding of the face and beauty, that's very, very important, we now get better results than we ever have. I was one of the first surgeons in the United States to bring ultrasonic rhinoplasty to this country. I learned the methods in Europe, in France, from one of the pioneers, and it allows us to no longer break the bones, to have the downtime, to be much more precise. Now, if you imagine that window we have over there, I can throw a rock into it and break that glass, which is the old school rhinoplasty, or I can use a glass cutter to precisely shape that glass, and the outcomes are not the same. And that allows for just a much more precise outcome. Same with facelifting, different types, different approaches. The artistic vision of the surgeon is what matters. We are so focused on technique oftentimes that we forget that the operator matters too. If you buy a pair of scissors, I promise you that the hairstylist with that same scissors can do one thing, another hairstylist will do another thing. My practice, we're laser focused on rhinoplasty and facial plastic surgery, facial rejuvenation rather. So you do something over and over and over. I used this suture, it did this. I used this technique, it did this. You look at it self-critically, and you come down to, okay, now I need to improve that. I need to improve that. As opposed to, here and there doing a rhinoplasty and over time just repeating the same thing over and over. We evolve as opposed to repeat.
Yeah. Yeah.
I love
Oh,
that.
that was fascinating.
I love
It's
that.
a beautiful reminder that true aesthetic work is both an art and a science, and when done right, it uplifts the whole person. So kudos to that. Well, we are officially out of time. Thank you. To learn more about Dr. Masood Saman, you could approach the ethical, bespoke facial surgery now with pride by following him on Instagram at Saman Plastic Surgery or at samanmd.com. That was the Going Deep segment.